Hello everyone. Greetings from Seoul, Korea. I'm Na Sunja and I'm president of Korean Health and Medical Workers Union. Thank you very much for inviting me. I'm honored to be here. Korean Health and Medical Workers Union is representing workers in public hospitals, private hospitals, and the healthcare sector in Korea. Our union, which has a total membership of 73,000, belongs to the Korean Confederation of Trade Unions. I will share the current state of COVID-19 in Korea. As of August 28th, the cumulative confirmed cases are 19,000 and the death toll is more than 300. The fatality rate is about 2%. In Korea, the confirmed cases grew sharply in February with over 900 confirmed cases per day. Then starting in May, the number dropped substantially to about 10 cases per day. Then in late August, that number jumped to 300 per day. So we have been practicing the second phase of social distancing. According to a government announcement in June, out of 133 healthcare providers who were infected at work, 77 are nurses. One doctor has died. Fortunately, no nurses have died. Although we cannot let our guard down yet, the Korean government and the general public feel that Korea's method of managing the pandemic has been successful overall. I'll explain why. First, Korea experienced the MERS infection in 2015. That experience has helped us to effectively respond to COVID-19. At that time, 186 people were infected and 36 died. Thanks to this experience, the government took rapid measures to come up with a diagnosis kit in February. Public hospitals had PPE in reserve, and some doctors and nurses personally had experience responding to MERS. Second, the government was transparent in sharing information. In 2015, when MERS hit Korea, a conservative political party was in power. That administration chose to hide everything, but the current government, which was born out of the Candlelight Revolution, made the information public and in turn received the trust of the people. Third, in the beginning, when the confirmed cases rose sharply, that increase in fact helped to control the spread. Mass infection started at New Heaven and New Earth Church of Jesus in Daegu. Korean Public Health Authority obtained a list of the church congregation who were then tested. Most members of this church were in their 20s, and among confirmed cases, there were not many fatalities. Fourth, active participation of the general public. Koreans have been closely following government guidelines. In public places such as subways and buses, everybody wears a mask. Fifth, the dedication and professionalism of healthcare providers, including nurses. Many doctors and nurses volunteered to go down to the epicenter of COVID-19 in Korea. Six, the government took the lead in establishing treatment measures centering around public hospitals. That turned out to be very appropriate. In each area, public hospitals transferred all their non-COVID patients to other hospitals, and then these public hospitals became designated COVID hospitals. Patients with mild symptoms were transferred to various residential treatment centers, which used to be training facilities. 7. Korea has universal health care. Every Korean is a member of national health insurance. At present, in Korea, 1.8 million tests were conducted, and out of those, 1% are confirmed cases. Most tests are conducted at public hospitals and community health clinics. Anyone who wants can be tested. The wait time for a test is about 1 to 2 hours. The maximum wait time for result is 24 hours. If you have a fever of over 37.5 degrees, had contact with COVID-19 patients, or movement has overlapped with COVID-19 patients, you can get a free test. For example, if one of your family members is a COVID-19 patient, or if you have been to a restaurant that was visited by a COVID patient, you can get a free test. Recently, when effective test tracing became difficult, anyone in Seoul could get a free test if they wanted. If an individual decides to pay to take the test, the cost is about 160,000 Korean won, or about $130. I don't believe that there is anyone who cannot afford to take the test. All COVID-19 related treatment cost is paid by the government. Next, I'll talk about nurses' PPE. In February, when COVID-19 cases increased sharply, there was a huge shortage of masks and PPE, so many nurses were very concerned. In Daegu, where the number of patients surged, there was a shortage of respirators and ECMO, which was difficult for everyone. In the beginning, PPE from the Center for Disease Control's reserve was used, but as the demand increased, there was not enough PPE. Due to the unprecedented surge in cases in Daegu, PPE was in short supply. So except for suits, everything had to be disinfected and reused. At that time, we used the PPE manufactured by 3M in the U.S. But then a Korean company, Johan Kimberly, started to manufacture PPE. The quality is slightly inferior to 3M's PPE, but at least we have enough supplies now. In the early days, the mask shortage was a serious problem. Our union actively insisted that the government needed to solve this problem. In particular, we strongly urged that the workers involved in cleaning and facility maintenance who are not full-time regular employees should be provided with PPE. As the mask distribution became an issue, the government actively participated. In hospitals, mask supplies were coordinated and controlled by Korean Hospital Association. Also, the general public was able to purchase masks at local drugstores. The government's public mask 5-part system allowed individuals to purchase 2 masks per week on a designated day. Starting in June, there were no limits. Next, I will talk about our union activities. As soon as COVID-19 hit, we formed a COVID-19 response team and worked tirelessly. Every day, we produced and distributed a daily COVID-19 publication, including the situations at 120 different hospitals. We also created posters encouraging the general public to support first responders, and prepared and distributed COVID-19 response guidelines for our members in the field. We visited hospitals where COVID-19 patients were being treated and met with the union members to learn about their needs. We then petitioned the government, held press conferences, and made statements making our demands known. What we asserted was for a stable supply of PPE, for a safe working environment, nurse education and training, COVID-19 related psychological and emotional therapies and counseling, paid time off, increased personnel, including doctors, establishing a national specialty hospital for infectious disease, and paid sick leave. We urged to have a 3-party dialogue between labor management and government. On May 1st, we celebrated World Labor Day with a small number of members. And on May 12th, which was International Nurse Day, we held a press conference. We've had face-to-face meetings with government officials to negotiate our demands. We also met with the Minister of Employment and Labor and the Minister of Health and Welfare, as well as the Planning Commission under the President. We also attended a meeting of the National Job Creation Commission. On May 27th, we began the collective bargaining process with the management for 2020. Along with the hospitals, our union facilitated National Assembly discussions. Labor and management made a joint statement about how to overcome COVID-19. Still, There are many inadequacies with Korea's healthcare system. Our union voiced these concerns to the government, and some of our concerns were accommodated. Once again, we realize there is lack of public healthcare facilities and healthcare personnel. Only 10% of all hospitals are public. Korean nurses have to take care of twice as many patients as those in OECD countries. Recently, we have been having an increase campaign. The goal of this campaign is to increase healthcare personnel and public hospitals. We also had a campaign stating discrimination and hatred can never solve any problems. On June 30th and July 21st, our union invited healthcare workers from various countries for video conferences. Infectious disease problems cannot be solved by each country independently. This is a challenge that all mankind in the world have to work together to solve. Life over money. Healthcare cannot become a cash cow. Let's all work together to fight and prevail. Thank you.